Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates in Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Hi everyone, I'm Amy Morgan. I'm the marketing coordinator for Pediatric Dental Associates in Orthodontics. We actually have two locations. We have one here in Bentonville and one in Fayetteville. I am here to talk to you today about the changes that are occurring for 2018 for the ARKids dental programs. This will take place for all patients who are on ARKids, whether you're on ARKids A or B, TEFRA, or any other type of Medicaid that offers dental services for your children. By now you should have been assigned to a program either known as Delta Dental Smiles for Kids or MCNA, and so we're going to go over kind of the changes that have come about with those two companies taking over that program. The state has selected these two companies based on history with the state and also with programs in other states. MCNA does run some other state programs, and they have had a very successful job there, and so we are happy to welcome them to our state to take care of our patients, and we've been having a very good working relationship with them since about midsummer last year when we started getting online for these changes. Delta Dental, you probably know just from it being an Arkansas company. Delta Dental of Arkansas is who got that bid from the state, and so they are running a program inside of their own program called Delta Dental Smiles. And then the kids program is Delta Dental Smiles for Kids. We're going to kind of go through those kind of step by step, kind of what you should be expecting, what you should already have, and what you can do if you are not assigned, and kind of what those assignments mean. Again, if you have any questions throughout the program, just let us know. Go ahead and comment below with the questions, and we'll try to get as many of those answered today as possible. First, we're going to start off with just the basics that as a recipient of the ARKids program, your child should have been sent information basically assigning you to one of these MCOs. MCO is a managed care organization, and that is the program that will run your child's dental benefits from here and as long as they are on the program. Your children could be assigned to Delta Dental Smiles for Kids or MCNA, and that is technically the insurance company who will process all of your claims, any prior authorizations that we need, and it's how we will be able to track your services through them. Be aware that there will be some children who will still remain on the state program for a certain amount of time, and then you will be assigned. So if you're a new recipient of the benefits, you will have around a 30 to 45 day window where you will not have an assignment of that MCO. So during those changes, you're considered just like you're on regular ARKids, and we do take that as well. So as a office ourselves, we have decided to take both of the plans, so you don't have to choose like, oh, my kid got MCNAs, they have to go somewhere else. We are actually accepting both of those plans, and we will continue to accept the ARKids plan as well. Some things that will remain the same are you'll still come for your 6-month cleanings. Your co-pays will still apply. So you could be on what we consider MCNA A or MCNA B, which if you remember on ARKids B, you have a $10 copay. So for every visit, you would still continue to have that $10 copay. And the same thing with Delta Dental Smiles. You would have a Delta Dental Smiles A or a Delta Dental Smiles B, and the B is where the copay applies. You'll still be able to come for exams, cleanings, regular restoration. Both companies will still be covering orthodontics as well on a limited basis. Those are case by case and are reviewed and have to have prior authorization for those. But as far as the coverage goes, those things have remained the same as they were previously under the ARKids program. As far as what you should have received by now, Delta Dental had a packet that was sent out to each family, and it may have come as one packet for the child, or it may have come as the family as a whole, but it should have included a beneficiary handbook and a brochure and a copy of their cards, which I'm going to show you what those should look like. We can still access the information with your ARKids number that you use for their medical visits, but we would prefer to actually have this card available. And so you should get this one from Delta Dental. Okay, so if you have this, we do need to get a copy of it at your next visit. So if you could bring that with you, that would be great. Same thing with MCNA. You should have received a packet in the mail that includes a member handbook or access to the member handbook, along with a copy of their card, which looks something like this. Okay, these are resources that may or may not have been provided. You may have lost them in the mail. We do have those available. If you would like to receive one of those, please send me a private message and we will get the correct copy to you that you need for that. Again, we are going to open it up for questions if anyone has any. And then if we don't have any right now, I'll just continue to go through benefits. So first off, when you have the changes, as far as our office is considered, nothing has changed in your coverage. We will still continue to accept your insurance, whether you're on the Delta Dental Smiles plan or the MCNA or ARKids, as it always was. There are a few added benefits to each plan, in that some of the frequencies have changed on how often you can get cleanings, but we still recommend 6 months apart. And there's a few other things that are just kind of inner office things that we have to work on, but it doesn't affect your treatment. One of the major changes is that there are some services that are not covered, that now we have contracts that we are allowed now. We've always been allowed to, but we can pass on that fee to you. So anything that is not covered, we are responsible, and we are being thorough about going through all of those with you at the time of checkout. If you're already a patient with us, you know that we bring the patient back, we go through the cleaning, we go through the exam, and then the doctor will talk to you briefly about what's going on. And if they do need to come back for treatment, they'll go over it with you about what they're going to do. And then you're brought up to the front and you're given a printout that shows you line by line what we're going to do on each tooth. Well, if any of those are not covered at that time, we will let you know, and we will let you know the price for those. Anything that needs prior authorization, we will also continue to take care of those. However, if something is denied for some reason, that doesn't mean that you cannot receive the service. It just means there will be an out-of-pocket expense for that. So if your child comes in and we think maybe they're eligible for the orthodontic program, we will see them on at our cost to go ahead and bring them in, do the records, do the photos, do all those things that are needed to try to submit that to the state. And then they will send it out to the program. They'll let us know if they're going to approve it or deny it. If they deny it, we will call you and we will go through the process with you to help you get into a payment plan or whatever you need to do to see if we can actually get the cosmetic issues fixed. Because usually they're only approving it if it's considered medically necessary. Other than that, there's a few added benefits. They do have really good customer service lines. I'll post those in the comments. I'll post a link to each of their member websites and the phone numbers so that you have that. And they've been both programs have been really good to work with. And then one of our main things that we really want to stress, which before I get there, let me see if we have any questions. Do we have any questions yet? Okay. So one of the main points we want to make is that you're being assigned to a managed care organization. So your child is either assigned to MCNA or Delta Dental Smiles. There is also an assignment of a primary care dentist, which if you are familiar with the ARKids program, you've possibly been assigned to a primary care physician or a PCP. And that means you're only allowed to go to that doctor's office, see not always just that doctor, but as long as you're assigned to that group, you can see any doctor in that group. With the primary care dentist, you do not have to go to the dentist that you have been assigned to. If you've been assigned to someone outside of our office, you can still see our dentist. There is a way to get that changed if you want to get that changed, but it's not something that is required for you to be able to see us in our office. So if you have been assigned to a different dentist in Northwest Arkansas, but you are already a patient with us or you want to be a patient with us, you do not have to have that primary care dentist switched in order to be seen in our practice. They don't have us listed as a group. They have us listed by individual dentists. So try to remember that we have 9 dentists in network. So if you have any questions to figure out if you're assigned with us or not, we'll be happy to look that up for you. Just give us a call and we can look that up on their system and see who you're assigned with. It should come in your paperwork as well. So if you got assigned to someone else, you do have the option to call and change it to us, but it is not a requirement to be seen in our office. And that is something that's been a little bit confusing for parents. So it is not the same as your PCP. Your PCD assignment, which is your primary care dentist, does not, I'm not sure the word I'm looking for here. It does not dictate which office you can be seen in. So as long as the dentist that you want to see accepts the program that your child was put on, so MCNA or Delta Dental, you can go to any dentist that's within that network, and we actually accept both. So other than that, your copays still apply. I went over that a couple of times. We're in network with both. Coverage is still the same as far as your 6-month cleanings. Let's see, I had some other on your assignments. They'll still do the cleanings, the fluoride, your x-rays, any kind of normal restorative treatments. Restorative, which is going to be your fillings or your crowns, that's where a little bit of the difference comes in that some of those things that are more complicated may have an out-of-pocket expense on a piece of it. And that's just because the new plans are a little bit more strict on the actual state guidelines. So the state guidelines haven't changed for anyone, just these insurances are being a little bit more strict on what they're accepting and what they're not accepting. And so that's one of the most important things that we want to drive home, is that even though a service may not be covered, we want to make sure that your child is taken care of from a dental standpoint. So we will work with you on those. We'll always be upfront about the cost. And we'll work with you on getting those taken care of, because ultimately our goal is to make sure that your child's dental needs are met as our group, okay? Let's see. On the brochure, if for some reason you have not been assigned, you'll need to call the number on the back of your current ARKids card and talk to them about that. Ask them if you've been assigned and you just haven't received paperwork, or if there is no assignment, how do you get that assignment? They can also answer any questions about both the plans. And again, I'm going to put the phone number for both plans underneath in the comments. So if you do have a particular question in regards to maybe your son was assigned to MCNA and you want to know when their next cleaning can be, or if they had a sealant on something, or you're trying to get information, they have your records from the previous ARKids program. So they have all the history in there. They can answer any questions. They can help you get assigned to us as your office, as your primary care dentist, if you want to go ahead and do that. Again, that is not a requirement for you to have an assigned primary care dentist that you're seeing. But if you are assigned to a different one and you want to be moved to us, all you have to do is call the number and they will get it changed over for you. It's very easy. I think they actually call us and say, are you still accepting patients under this program? And as far as we are concerned right now, we will always and forever be accepting new patients under that program. So if you have any friends that have questions about that, you know, you can refer them to us. We're happy to always answer questions. Our phones are answered from 8 a.m. to 5 p.m. every day by a live person. You don't get a machine. So we always have people available to help to answer those questions. One other thing I do want to go over, and this is something that I just think parents in general don't have the information. So what we've been seeing lately is that insurance plans where your employer provides the coverage under Delta Dental of Arkansas. So I believe, I hope I don't mess this up, but I believe that's Tyson and JB Hunt and a couple of other ones, but a lot of local big businesses. If your child is covered under the state program and your employer insurance, we need the employer insurance information to be able to file your state insurance. So what's happening is some of the children are coming in, we're filing it, and then they're coming back and paying us under your employer group, and then coming back and paying us under that. So just to make things a little bit easier and simplified for you, if you can just provide us with both insurance plans, then we are happy to file both of those on your behalf. And they can look it up for you. So if you don't have a card, or you haven't received that information from your employer, or you want to know, like sometimes we can actually look that up for you. So feel free to ask questions. That's what we're here for. We want to make sure that you know what is covered. One thing I'll recap is just off the cuff, as far as like we take ARKids, which is the new MCNA and the Delta Dental Smiles for kids, but we're also in network for the majority of Delta Dental plans, so it doesn't just have to be Delta Dental of Arkansas. We're also in network with most Blue Cross Blue Shield plans, and we are also now a provider for Cigna, which I know Procter & Gamble falls under that, and I'm not sure who else is local that falls under Cigna, but we are a provider for Cigna as well. So we're trying to go with some of those bigger groups and get some of those employers' benefits put in there. Again, at any time, if you have questions about what insurances we accept, we'll be happy to go over that with you. We will file with any insurance company. So any insurance company that your employer gives you, we will file that claim for you. It just may mean that maybe they have some out-of-network benefits and things like that, but most of the time, being a pediatric practice, they actually will pay a higher fee for the pediatric dentist to see your child, so it actually ends up being more coverage for you. But that's just something we can talk about, on the phone personally. If you have one of those plans and you want to discuss that, just give us a call. Our insurance coordinator is Angie, and she's awesome, and she'll be happy to look any of that up. Anybody who answers the phone can take your information, and we can pass it on to Angie, and she'll call, get your benefits, all that information. There's a couple of questions you have to answer as far as subscriber number, maybe the phone number to the insurance company, things like that, for us to be able to look it up, but we're happy to look that up for you ahead of any appointments if you need that. To recap real quick, if you did not receive a packet in the mail with your child's information, you need to call the number and see who they've been assigned to. You can also call us and see, we can try to check as many of those as we possibly can. Once you know who your assignment is, if you don't have the packet with you, we can get them for you. So we have the handbooks available, and if you want to private message us, I'll be happy to send those out to you today. And we'll get those in there to you. Again, these include your cards. So a card isn't necessarily required for you to be able to come to the appointment, but it does help us to be able to look up those benefits more efficiently. Any information that you have regarding any insurance information just helps us to be able to file those claims faster, get those processed out so that you don't receive a bill in the mail because something didn't get filed correctly, okay? I'm trying to think if there's anything else. I think we're good. Okay. If, again, any questions, please private message us. I'm going to post the websites and the phone numbers in the comments when we're done here. I'm happy to answer any questions. Continue to comment. This is actually going to end up being the replay that you're watching. So if you're watching to the end here, comment below. We will still be responding to all comments as long as possible. And message me on Facebook if you want a copy of the handbook. Other than that, if there's not any other questions, we're going to go ahead and close out for today. And also in the comments, if you're watching, if there's other things that you want us to go over in a live video, like if you have questions about bringing your child to the dentist or anything like that, let us know. And also share this with your friends, please. We appreciate it. Thanks. Bye.